Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant, 0.18 milligrams, is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye.
So I'm going to talk about a patient of mine who's a 71-year-old male with a history of decreased vision beginning 4 years ago. The patient had a history of retinal detachment in his right eye and subsequently had ptysis and a prosthetic eye. In his left eye, he had low-grade vitritis approximately 2 to 3 months after a retinal tear procedure. He was given multiple short-duration intravitreal corticosteroid implants to control his relapsing cystoid macular edema, and he ended up having about 8 shots given every 3 months over a number of years. He presented for potential YUTIQ injection with a vision of 20/60, a pressure of 19, no cells in the anterior chamber, but trace haze and 1 to 2 plus cells in the vitreous. His OCTs showed cystoid macular edema and a very mild epiretinal membrane with intraretinal cysts and a bit of subretinal fluid. Given the fact that this patient did seem to have good success with intravitreal dexamethasone, he was given a YUTIQ implant and followed up a month later. He had a small residual intraretinal cyst, which was gone by month 2 and stayed stable up to a year and 18 months afterwards. Essentially, at his 18-month follow-up, his vision was 20/30, his pressure was 16, and he had a little anterior segment cell, which was managed with a mild topical steroid. He had no vitreous haze and no vitreous cell and a small epiretinal membrane, which was stable. In terms of following this patient, we followed him every month for 5 months to see whether or not his macular edema would recur, and 2 to see if he would get an intraocular pressure spike, which he did not. Then he was followed at months 8, 11, 13, 14, 15, 17, and 18, really to make sure we weren't missing anything. This patient has now been followed for 2 years and has not developed a recurrence of his macular edema and has not needed rescue injections. I'm going to continue to monitor his inflammation as well as intraocular pressure pretty much on an every 2 to 3 month interval just to make sure that neither of them recur. In this case, the patient's been able to maintain his driving vision and is able to continue to drive at night. He stopped complaining so much about his fluctuating vision. Thanks for your attention.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant, 0.18 milligrams, is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea, and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.